Hello Michael, thank you for coming to the latest edition of Optomask.
It's a pleasure, I'm honoured, Yasin, thank you very much.
Is it okay if we start asking questions?
Of course it is.
So as usual and traditional, just tell us a bit about yourself.
So my name's Michael, I'm currently an optometrist working for Specsavers. I've been qualified for almost 3 years. I'm just really trying to make sure that I can broaden my horizons and make sure I can give the best care for all patients that walk through the door of primary care. I currently do low vision, medical retina, I've got prostatic glaucoma, and I'm doing high glaucoma and IP at the moment just to make sure that I can tick every single box.
Keeping you very busy.
Very busy. I like the differences. You want refractions are good, but it's nice to have a bit of variety in them.
And this is you're currently with Kelly in the teaching tree.
I am, yes.
This is your 4th week. How are you finding it?
I'm really enjoying it. It's filling me with more confidence that I can take with me into primary care, and I feel like it's improving me as an optometrist.
Fine, fantastic. And how does it work?
So initially you have a session or two where you're just observing, which I find very helpful because you can work out how to use it's obviously not Socrates, it's not, you can work out how to use the system, you know that the appointments work and what order to do things, so it really helps you start when you actually get to start testing.
Fine. And what sort of patients are you expected to see, or what patients are you seeing?
So you see quite a broad variety. Obviously, you see your normal emergency examinations such as anterior uveitis that needs treatment, but it's really anything that needs prescribing. And so you do obviously see more interesting cases as well, which gives you a bit of variety. So, for example, you might see a patient that's having a side effect to their glaucoma drops and needs to have their drops changed, which is obviously something that we wouldn't normally see in primary care. So it really improves your scope of practice.
Widens it out.
Yeah.
Once you've seen the patients, how do you log it on your record, or you log
So you log it. There's a logbook on something called PebblePad,
right.
But rather than logging every single patient that you see, for the first semester you pick 10. Obviously try to make them more varied. You don't want all of them to be anterior uveitis, so you want to have a bit of a variation of them all. And then you'll have to log another load in the second semester as well.
And how many sessions are there in the semester?
So you do 12 sessions in each semester, so 24 sessions each. It depends how you do it. So if you're HEIW funded, you might do all of the sessions in the hospital, or if you're being funded by your employer, then you might go and do it with what they call your DPP. So that'll be someone in primary care who's an independent prescribing optometrist who you'll do some sessions with them instead. So it depends, but 24 sessions is what you need to do.
This is an experienced IP optometrist.
Yeah, I think it's 2 years qualified, yeah.
Fine. And how does an optometrist keen on getting involved or learning more about how to get involved in the teaching tree, how do they go about?
So obviously you need to be doing the independent prescribing qualification. I'm personally doing it with Cardiff University. And then so Cardiff University have set up this teaching tree clinic so that all the students in Cardiff University can come here and then they can get their sessions in and see the variety. To actually organise the teaching treat clinic is very straightforward. So you just email the coordinator. So I emailed Angelisa, and she will make sure that you've done your track and you've got your honorary contract, so you've been accepted. And then she will allocate you the dates that you're able to go to the clinic.
Well, what's the track?
So it's just the track website to apply for the honorary contract.
Tells you where you're progressing.
Just, they do a DBS and things like that just to make sure you are, I guess, who you say you are.
And what have you learnt in your 4 weeks?
I've learned a lot. I've learned how to be a safe, autonomous, confident in prescribing, but it's taught me just to be more relaxed with these patients. So if I see them in primary care, I already know what I'm doing. So it's just, again, widening my scope, and I feel more confident in anyone who walks in the door.
Yeah, this is about building confidence. The more you see those types of patients, the more confidence.
The more confidence you get. I'm personally a learner that needs to be doing something to learn it a bit better. So this is absolutely ideal for me, and it's very enjoyable.
Hands-on person.
Yes, exactly.
What will be the next stages after this? Your sessions are finished.
So once the sessions are finished, we will be. I should hopefully have the independent prescribing qualification. So once I get my pad, I'll be able to prescribe in primary care.
Right.
But obviously, it opens up a lot of avenues. You know, if you wanted to work in the hospital, a lot of the jobs require you to have independent prescribing. So it's if you're the type of person who wants to work a day or so in the hospital, you'd be able to open up a few more avenues for yourself.
Because it's something you've mentioned before that you kind of aspire working.
I'd enjoy working in the hospital a day a week. I enjoy primary care, so I couldn't see myself ever leaving there. But I love the variety. You know, I enjoy a WEX. So hospital is like every patient being a WEX. You know, and it's an enjoyable experience and varies your life. It stops it from being mundane of refracting all the time.
What advice would you give an optometrist who's just going to start their teach and treat?
I would say there's nothing to worry about. I'm sure you're going to have an excellent mentor. You know, obviously the mentor here in Swansea is amazing. Kelly is amazing, and you just make sure you know what you're doing. A lot of it you'll know already. You know, so have an idea of what you can prescribe. Have an idea how to find the drops, and just go in there fully confident and enjoy yourself.
Fantastic. And obviously, we got IP, you got your prescription pad. How do you think that will benefit you back in?
Well, I think that there's a lot more people getting IPs. So there's more prescription pads going out, but it's still not a massive number. So if someone came into my practice and they needed something prescribed, and we didn't have an independent prescriber, we'd have to send them anywhere. Now, some of these people, for example, they don't drive or they find it difficult to get to the place. So it's a bit of a hassle for them to go there. And so it ensures that we can give all of our patients the best possible care and keep it in-house. So I think it just makes sure that the patient gets the best possible care. So
Michael, how do you see the role of optometrists changing both in primary care and secondary care?
So I think the role will change quite a lot. It will be much broader as more people will have IP and the extra qualifications, meaning we can do some more specialist examinations. It will help secondary care a lot because primary care can take a bit of the workload off. So the more urgent patients will be seen quicker in secondary care because we can see the less urgent ones and maintain the continuity in primary care. So it really will help both ways. I think optometry as a whole is growing and becoming noticed more for the skills that we have. I think overall, I think it's just a massive help for everyone involved.
Fine. What would you say the take-home message is? Ideally, is we want to retain as many optometrists in the profession as we possibly can.
Well, I think the take-home message, I think one thing would be that a lot of people don't know that it's not just primary care that you can work in secondary care. So you don't have to be stuck in primary care for all the time. You can work in the hospital, you can do glaucoma clinics, medical retina clinics, you can learn yang capsulotomy, SLT, you can learn these other skills that you may not have realised that you were allowed to do. Maybe you thought that just doctors were doing it in the past, but it's something that us optometrists are capable to do. But overall, I think that if you're an optometrist and you're worried about losing the excitement for the job, then there's a lot of exciting things you can do to light that fire in you again. And if you are looking to do optometry, but worried it is only refraction or mundane, it is far more than that and always growing in scope.
I think also to add to that, I think what I'd like to see is more optometrists working in a hospital like in Bristol Eye Hospital, Moorfields Eye Hospital. They've got such a big number of optometrists working in both hospitals, and it'd be nice to see them working here.
I don't think enough people know about it. I mean, I speak to colleagues now who don't realise that you can work full time in the hospital like yourself. They may think it's a part-time or 1 day a week or a half day, but no, it's something that if you want to work in secondary care, you can. If you want to do refractions all day, you can do that as well. But you're not stuck to one thing. There's a massive variety of things you can do with the job.
It's just, I guess, making more optometrists aware of what they can do and what they can't do.
Exactly.
Well, thank you very much, Michael.
Thank you very much, Yasin.
Thank you. Bye.